The Eastside Health and Wellbeing Collaborative is comprised of 24 community organizations that are situated in or serve the east side of St. Paul.
Committed to using an engagement approach to address the inequities in the communities they serve, Fairview came together with the East Side Partners.
We were, big healthcare looking to get immediate results, and one of the early lessons was, in order to do this right, this had to be done through a co-design process and co-implemented with community and have the voice of community, and we were just one at the table.
On the east side of St. Paul, we are a culturally diverse community. We have so many resources, so many talents, so much wisdom in that community. And so really the collaborative is able to bring these pieces together and almost serve as a broker.
With that setting and that ability to start developing a shared understanding of community and a shared vision for what could be on the east side of St. Paul, we were able to start in a way that really reflected that we wanted to work at the speed of trust.
For the community partners involved in the collaborative, that trust took some time.
There is a huge mistrust in the Native community for all systems, but in particular health systems, due to the historical trauma of how that was used with them.
Building trust was hard in the beginning only because the community that we serve has experienced a lot of systematic trauma.
The understandable community mistrust of healthcare and other service providers informed the co-design of 2 programs developed from community-identified needs. The first being the Cultural Broker Program.
Our Eastside Partners wanted to have a program that could help community members navigate care. Our culture brokers are our employees, and we have an office in these community partner sites.
Helping to break down barriers and disparities for those they serve, the brokers are embedded within the African American, American Indian, Hmong, Karen, and Latino Hispanic communities.
As far as our cultural broker, as a part of this collaborative, she's really worked with families to chart that path out of crisis. And then once they're stable, there are so many other programs that we offer even for adults here that they're ready to take on other things so that they can move their entire families forward.
Our cultural broker is somebody in the community that is well respected, knows multiple systems, and is able to respond and say, hey, I think I have a resource for you. Let me walk alongside you and help you with that.
There was also a community need for increased healthy food access. The collaborative responded by developing East Side Table, a make-at-home meal kit program. The goal was to improve access to nutritious food, build food skills, and encourage meals prepared at home.
The food-focused intervention was an idea that came to light from one of our community partner organizations. It wasn't an idea that we ourselves would have thought of as a health system, but really gave us the chance to hear directly from community voices and ideas and allowed us to be able to co-create something.
Now celebrating 10 years, these partners continue to thrive. Community dental care is one of the many examples of organizations that are flourishing through the work of the collaborative.
It's amazing to have partners on the east side and throughout this collaborative who you can just email or pick up a phone and call. And when you need a resource and you've built these relationships over time, the support system's there.
Every time I have contacted them for something that I've been looking to fit into the community that is outside of our collaboration, they have been able to provide me with a contact, somebody I can talk to.
This collaborative has been a lot for me. Again, that networking that I needed, the connections that I needed, learning to legislate or talk to policymakers about the things that we've got going on. So it's been a great opportunity.
There has been from the start and continues to be very deep mutual respect. We respect what each other are doing and have a deep appreciation for the impacts that they're having individually in the community.
To see how this collaborative built out and the programming has lived on and continues to grow, this co-design, co-implement model is now driving programming across the state.
There really is a sense that there's something magical happening on the east side of St. Paul and that there's so much to keep investing in. And so to really marvel at what we've been able to find there and to get to be a part of that story has been really incredible.
Our neighbors are calling, and the ability to have these kinds of programs to be able to support our communities, that's good for us all.
Congratulations to 10 amazing years. I look forward to so many more with all of you in this room.
I want to wish congratulations to our collaborative effort for the past 10 years, and I really look forward to the work that we're going to do in the future.
So grateful for all the work that you're doing on the east side and all the lives that you're helping us touch.
I want to thank all of our collaborative members, past and present, Personally speaking, this has been a highlight of my career, the way we've been able to pull together and do this as a community and impact our community in so many significant ways.
Thank you for being on this journey with us. I can't wait to see how we innovate and how we explore and how we tackle new challenges in the community and help to inspire the next generation of community health programs.
I want to thank you all for the opportunity, for the partnership, for being who you are and sharing that with us and our community. And I'm really excited for the next 10 years to come.